Good afternoon. My name is Lars Anker and I'm a neurosurgeon at St. Joseph Hospital. I take care of surgical problems related to the brain and to the spine. Today I would like to talk about stenosis of the spinal canal. This condition is important to me because it tends to be underdiagnosed and sometimes patients are unaware that they have it. Spinal canal stenosis means that the spinal canal that holds the spinal cord and the nerve roots, which are supplying strength and sensation to the legs, is too narrow. If it gets too narrow, the spinal cord and these nerve roots can get compressed. Characteristic of this condition is a difficulty walking. The patient will describe that they can walk only for a set distance. Then they develop an intolerable pain in the buttocks and in the back of the thighs that forces them to sit or lie down. Interestingly, after only a few minutes, they can walk again for about the same distance until these symptoms recur. This is decidedly different from a vascular problem afflicting the legs, where the pain would mostly be located in the feet and in the calves. The patients are also seen leaning over forward. They walked in a stooped fashion. That is because in this way the spinal canal opens up just a little bit more and they can walk for longer. Often a patient will, for example, gladly push the shopping cart because they can lean forward and their walking distance increases. If you or one of your friends or relatives is afflicted by this difficulty, you should see a neurologist or neurosurgeon to see if an imaging study of the spine should be performed. The best imaging study for the scenario that I described is a MRI scan of the lumbar spine. It can definitively rule in or out compression of the neural elements within the spinal canal. If such a compression is found, a referral to a neurosurgeon should be undertaken. The neurosurgeon can then evaluate whether the patient is a surgical candidate. At St. Joseph Hospital, we have the latest technology available for surgical approaches to the spine. Often, if only a single level is involved, it can be decompressed in a minimally invasive fashion with just a one-night hospital stay. If more than one level is involved, an open approach is required, but even that typically results just in a hospital stay of 2 or 3 days. Often, already the evening of surgery, the patient will report a better ability to walk, and often when they come back to clinic a few weeks later, they report that their quality of life has increased substantially.